California is declaring a state of emergency because of the coronavirus. Health officials say an elderly person died from the virus at a hospital in Roseville. Thanks for staying with us. I'm Brian Morton.
And I'm Alicia Rubin. Washington State has reported its 10th death. That brings the U.S. total to 11. No one has died from the virus in Oregon. We're still waiting on tonight's update from the Oregon Health Authority, and we'll get you that as soon as it comes in. Here's what we know so far. There were no new cases reported yesterday. 3 people have tested positive. One of those cases was confirmed by the CDC. 18 patients are waiting for results. 227 people have been cleared of the virus. More than 100 people are being monitored, and that means that they're not showing any symptoms, but they may have been exposed to the virus. There are no confirmed cases in our region.
Since there are cases in Oregon, people are wondering what the best ways are to stay healthy and safe from COVID-19.
And we keep hearing about washing our hands with soap and water, but what else can we do? Newswatch 12's Leah Thompson is live, and today she talked to health officers from Jackson County to get some answers.
The other best thing you can do is stop touching your face. This goes for any virus. When you touch your face, Jim Shame says this allows the virus to enter your body. Another big thing people can do is stay home if you're sick. Don't go to work and don't send your kids to school. Jim says this is something that needs to end. When you are home, make sure you're wiping down counters, doorknobs, and light fixtures. But Shame says still, the best thing you can do is wash your hands.
I think we hear it and it kind of blows by and we don't think it's really significant, but this is a serious illness and we have good strategies to cope with it. We don't have a vaccine, we don't have medications, so let's go back to the basics.
Shame says it'll be another year or so before a vaccine is available. Coming up tonight on Newswatch 12 at 6, you're probably reading a lot of things online about COVID-19. We'll tell you what's myth and what's real. Live in Medford, Leah Thompson, Newswatch 12.
Concerns over the coronavirus has led a lot of people to buy out items at the grocery store.
And we've been getting reports of long lines and empty shelves across the country. Sherm's Food for Less in Medford says it's definitely noticed an uptick. People have been buying up paper products, bath tissue, water bottles, rice, and beans.
Actually, Saturday was kind of the first even notion that anything was going on. I really probably think it was the stuff up in Washington, you know, and more has come out about that. But that Saturday is really the day that people started taking notice.
So what should you be stocking up on? Food-wise, it's good to have some food on hand that has a long shelf life. Emergency managers say that it's a good idea to have a 2-week supply of food, and that's good for any emergency, not just a viral outbreak. CDC says it would be good to have plenty of water and drinks with electrolytes like Pedialyte or Gatorade. Basically, it's the kind of stuff you'd want on hand if you were sick with a cold or flu. And that goes for medications as well. The biggest message is to be prepared, but don't hoard more than you need.